Hello and welcome to this recorded meeting for the Vision Trilingual Preschool employees with the benefit plan beginning August 1st, 2003. My name is Bill Hammett. I am honored to be your insurance broker. Happy to help you with anything you need throughout this process. My contact information is right there on the screen for anybody that needs additional help throughout the year. Even through open enrollment, Rhiannon and Anna are available to you. Both of them can help you with things like finding doctors, understanding your plan, getting new ID cards. If you run into issues with claims or having trouble getting into a doctor, these kind of things, you can reach out to us and we can kind of be your first stop and advocate. Quick little agenda of what we're going to be going through. We'll talk about the timeline of open enrollment, the medical plans available, dental and vision plans are also available. Talk about how we enroll and where do you go with questions. So let's just talk about open enrollment to start. July 6th through July 13th is our open enrollment period. This is when you can enroll or waive your benefits. You can add or waive your dependents. Any enrollments that you make, any changes, anything that you do would be effective on August 1st, 2023. You must complete an enrollment no later than Thursday, July 13th, and you'll do so through the Ease Benefit Portal, which we'll discuss here shortly. First, let's talk about the medical plans we have available from Anthem Blue Cross of California. We have 7. We have 3 PPO plans, bronze, silver, and gold. And then we have 4 HMO plans, 2 silver, 2 gold. You'll notice that priority select and select, those terms are underlined. We'll talk about those in detail. And I'm going to talk about them with you every opportunity. They are the exact same plans in terms of benefits. Priority select will be a little bit cheaper than select. It has a little bit smaller network of doctors than the select network, but the benefits are identical. So when we get into benefit discussions, you'll see that they are exactly the same. The difference is the network of doctors you're visiting. So the select plans are generally sharp doctors, or it's a network focused on sharp doctors. The priority select in green is focused on Scripps doctors. So it's not just Scripps, it's not just Sharp. There, of course, is other medical groups available. On the screen here, you're going to see some of the more popular ones. You'll notice Greater Tri-Cities IPA is in both networks. That's important for those of you in kind of North County inland. This means you can choose either one of them to get to Greater Tri-Cities IPA. Just a matter of if there's any of those other groups that you might want to be a part of. So if you have a spouse enrolling that likes Scripps, but you like Greater Tri-Cities, you'll want to go with Priority Select, and vice versa for some of the other ones. If you like UC San Diego for yourself, but Greater Tri-Cities for another family member, you might want to go with Select. So let's talk about our medical plans. Here you see 2 different plan designs. Again, I'm going to reiterate, this is actually 4 different plans. Up here at the top, there's the Silver Select HMO plan and the Silver Priority Select HMO plan. That's 2. These are 2 silver plans. And here we have 2 gold plans. One is the Gold Select HMO 30, and the second is the Gold Priority Select HMO 30. Again, the difference is in the network of doctors. The benefits are exactly the same. So let's talk about these benefits real quick. Let's start over here on the left. You see with the silver plan, there's a $2,500 deductible. A deductible is, generally speaking, what the insurance company requires you to pay in full before they start to pay any amount. All right, so this means with this silver plan, you're going to come out of pocket $2,500 up front before Anthem starts paying. Now, there are a lot of exceptions to that rule I want to point out. Everywhere you see this term DED waived, it means deductible waived. Okay, you see it here for office visits. $60 for a regular visit, $110 for a specialist, deductible waived. That means you do not have to pay 100% of the cost up to $2,500. These are called copays. Copays you're going to get with the deductible waived in most all instances. Okay, so you see here for a diagnostic lab and x-ray, if you're doing this in an office setting, it's $20 deductible waived. $20 deductible waived. Freestanding facility for lab, you're going to find 0 cost deductible waived. But if you're doing it in a hospital setting, they're going to charge you 45% of that cost after you meet your deductible. So here's the opposite of deductible waived. It's after deductible. You see it here also with imaging. So this is CAT scans, PET scans, MRIs. In an office or a freestanding facility, so not in a hospital setting, you're going to pay a $200 copay, deductible waived. However, if you're in a hospital setting, even if you're not an inpatient, outpatient, or you go to your doctor who is in a hospital, you're going to pay $350 as a copay, but after the deductible. So it's super, super important that you understand that difference, because an MRI could cost you a lot more if you do it in an outpatient hospital setting. So what this really means to you is we need to be consumers. We need to understand that we have the ability to reach out to our office staff, reach out to the member services number on the back of your card, which is the most efficient way to do it. Reach out to them and let them know, hey, I need lab work, I need an x-ray, I need a CAT scan, a PET scan, an MRI. I understand that if I do this at a freestanding or an office facility, it's a lot cheaper. Can you help direct me to somebody in my network, in my medical group that can do that? Here you see for rehabilitation or habilitation, that's physical therapy, occupational therapy, speech therapy, $60 copay, deductible waived. Chiro, $15 copay, deductible waived. All the way down here at the bottom, urgent care, $60, deductible waived. So that's very important, because this $2,500 deductible can be very scary, but understand regular doctor visits, specialist, blood work, x-rays, MRIs, physical therapy, chiropractic, generic drugs, urgent care. All of those benefits you are going to be able to access at a copay without ever having to touch your $2,500 deductible. Okay, so that's important. That means for those of you that don't have a lot of medical needs, that want to save money on premium, that just need doctor visit copays, prescription drug copays, the Silver plan is a really great option for you. So then when does this deductible come into play? So let's use the example. Really, it's down here at these big items. So hospital services, outpatient surgery, emergency room. That's where you're going to get a lot of that. Okay, so you see these percentages. You also see them on the MRIs with the outpatient hospital. There's a percentage for x-ray and lab. So when you see after deductible, that means you're going to be on the hook for 100% of the discounted price. Discounted price just means that all these doctors and hospitals have arrangements with Anthem Blue Cross that the amount that you pay is discounted off of the non-insurance cash off the street rate. So that's discounted rate. You will pay 100% of that up to your deductible. So let's use a pretty extreme example. I get in a car accident, $100,000 in hospital bills. I've not used my plan at all. This means I would pay 100% of the cost for the first $2,500. Then I pay 45% of the remaining cost. Anthem Blue Cross pays 55% until all of the money I've spent, my total out-of-pocket maximum equals $9,100. Once I've spent $9,100 on that hospital stay or any of these services, all these copays, $60 for physical therapy, $15 for chiro, $15 for generic drugs, $60 for urgent care, $20 for an x-ray or a lab. All of those amounts are rolling forward towards this $9,100. So whether you do it in 100 different copays or you do it in one big hospital stay, once you have spent out of your pocket $9,100, you do not pay anything else for the rest of the calendar year. So on January 1st, these deductibles all reset to zero. The out-of-pocket maximums all reset to zero. So if you find yourself having a very expensive year, what's super important is to load up on everything you need. Get the prescription drugs you need. Get all the physical therapy you need. You're going to find yourself at a place where you've hit this 9,100, which means you've had a tough health year. But in terms of the health insurance plan, you do not have to pay anything else for the remainder of the year. You don't pay for doctor visits, hospital stays, surgeries, MRIs, any of it. Okay, so that's your maximum out of pocket. Now look at how much different the gold plan is. You've probably been kind of peeking over here already. No deductible. Maximum risk is $6,600. Copays are a lot less. We didn't talk about prescription drugs, but over here we have a $200 brand name drug deductible. That means if you need a brand name drug, you're going to pay 100% of the cost for the first $200, and then you pay these copays of $70 or $80 or $110 or $120. All right. We'll also talk about these different levels of pharmacies. So there is level 1 and level 2. Anthem has better discounted arrangements with certain pharmacies and not so with others. And so they kind of split them up into a couple of different levels. We'll talk about that. Again, important to be a consumer when it comes to this stuff. Where these plans differ the most is right here in all the big ticket stuff. So with the silver plan, if I go to the hospital, I have a $2,500 deductible, plus I pay 45% not to exceed $9,100. Surgery, same thing. Emergency room, same thing, plus a $350 copay. Okay. That's plus, not instead of. Okay. But over here, I only pay $600 a day with the gold plan, 4 days max. This means if I stay 7 days in a hospital, I pay $600 day one, $600 day two, $600 day three, $600 day four. And on day 5 and beyond of that same hospital stay, I no longer am paying my copay. This $600 per day gets you room and board. It gets you the place. It gets you the hospital bed. It gets you the nurses coming in and out. It gets you the advice from the doctor. But keep in mind, when they start wheeling you out of there, doing blood tests, doing x-rays, doing surgeries, those are additional costs on top of that. And you see here with the surgery, it's a $450 copay. Emergency room visits, $325. So what's really critical as you're looking at these two plans alongside one another, of course, all of us are going to want that gold plan with no deductible and lower copays across the board. But here's how you decide what's best for you. You think about the last 2 or 3 years. How many hospital stays have you had? How many emergency room visits have you had? How many surgeries have you had? How many MRIs have you had? Do you take a lot of prescription drugs? If the answer is basically none or no to all of these, you're a really good candidate for the silver plan. But also factor in, what do you know about your health and your activity within the healthcare system over the next 12 months? Are you having a baby? Do you need a knee surgery? Do you participate in a lot of extreme sports and wind up in the emergency room 2 or 3 times a year? If you said yes to any of these questions, you're going to really want to focus on the gold level plans, because while yes, it is going to be more expensive, the money you're paying out of your paycheck is coming out pre-tax, and the money that you're spending on these services is going to be at a copay level, which means it's going to be far less expensive to you. So while you'll pay another $20 or $30 or $40 a paycheck for the plan, you will save thousands in a hospital stay. You will save thousands at an emergency room visit. You'll save thousands with the surgery. So that's how I want you to think about those plans. Here's our PPO plans. I'm not going to go through that same exhaustive detail, but you can see here with our PPO plans, we've got a very high deductible bronze plan. This is a great plan for any of you that don't really use health insurance at all, but you want access to a larger network. PPO plans have a much larger network of providers. HMO is much smaller. With HMO plans, you must choose a primary care provider. You must get all your care within certain medical groups. With a PPO plan, you can choose a different doctor for every day of the week. There is a much larger network of these providers. So if you value freedom of choice and being able to self-refer yourself or move within the Sharp network to the Scripps network to UCSD to Tri-Cities, you're going to need a PPO plan, because that's the only way you can get to all of those different type of providers for yourself. The bronze plan is going to be your lowest cost PPO, but buyer beware, very, very high deductible, $7,300 deductible. Okay, so you see not quite as many services with deductible waived, although there is some. We got doctor visits deductible waived. We've got lab and x-ray in an office or freestanding facility at a copay. We've got an urgent care benefit at a copay. Those are great. But our pharmacy deductible is now $650. Our copays are way higher. Our deductible is much higher. If we go to the hospital, we're out of pocket $7,300 up front before they pay anything, so careful. Our silver plan, this is kind of our best value PPO plan, much more manageable deductible at $2,200. This is for those of you that want a PPO plan, value the choice, and are interacting with the healthcare system from time to time, and don't want to have a $7,000 deductible to contend with. Again, copays for similar things. Prescription drug, brand name drug deductible is lower. And then we have our gold plan. So this is for those of you that value choice and are going to be using your health plan a lot. This will be the most expensive plan available to you, but it's got the best benefits for a PPO plan, no brand name drug deductible, no deductible overall. Last little note here, you'll notice we have kind of skipped over it, but there's individual numbers and there's family numbers. So for those of you that are enrolling by yourself, with no kids, with no spouse, that second family number doesn't mean a thing to you. But for those of you that are adding a child, adding a spouse and child or children, this family number is double in every instance. You'll notice it's exactly double. And what it means, you'll see the term embedded. Embedded is a very important term here. What embedded means is that basically no one person inside the family is going to be asked to pay any more than their individual deductible. Once somebody meets that individual deductible in full, then the rest of the family has the other half of the deductible. All right. You can also meet it on a cumulative basis. So if it's me and my family of 5 and we're on this silver plan and all of us have $1,000 issues that require us to pay $1,000 towards a deductible, none of us will have met this $2,200 individually. But as a family, once we spent $4,400 collectively on the aggregate, then it is met. The family deductible is met. Okay. And then we get all these benefits after deductible. Okay. Another example on that car accident, it's me on the plan with my wife and 3 kids. I get in the accident. I'm on the silver PPO plan. I will pay my deductible of $2,200, and then I'll have paid my individual deductible in full for the year. Then I pay 40% of the cost, not to exceed $8,600, which means for me in the family unit, all of my expenses will be covered at 100% for the rest of the year, and my family will have the other $2,200 deductible and the other $8,600 of out-of-pocket maximum. So those are our 7 health plans. So a couple of little things here to help you use your plan. So Anthem Blue Cross uses what they call the Sydney app. That's what they call their mobile app. Really great stuff here. You'll see us hit on it a couple different times, but virtual visits through the Sydney Health app. So this is super helpful, keeps you from having to schedule an appointment, go to the place, wait a couple of weeks, all that kind of stuff. Spend 3 hours out of your day just for something that somebody over the phone could have helped you with. Again, more information on virtual visits, including mental health support from home. Again, signing up for the Sydney app is easy. You just go to anthem.com/CA. And when you connect there, you'll find the Sydney app. You can also go to the iTunes or Android store and download it. Also, part of what you got here with the Anthem Blue Cross Health Plan is an employee assistance program. This is something that can be super valuable to you. This is where you can go and get help. This is outside of the company. This is straight with Anthem. It's completely confidential. It's available 24/7, 365. Help with counseling, legal consultation, financial consultation, emotional well-being, drug and alcohol abuse, marital issues, financial issues, even help with adult child care, elder care, pet sitting, all these things. Really, really cool stuff available with the Anthem Sydney. The Employee Assistance Program, the EAP program with Anthem. So great resource for you there, phone number right there for you as well. So we talked a little bit about the prescription drug plan, had an RX, different levels of RX network. So level 1, basically, if you're going to CVS, Target, Walmart, Costco, this is where you're going to get the better prices for the copays for those prescription drugs. Other prescription providers such as Walgreens, Rite Aid, this is where you're going to pay more. So we're going to want to steer you towards CVS, Target, Walmart, Costco. To find a full list, you can just go to anthem.com/CA. You choose order and manage prescriptions. You're going to need to log on. So this is, again, you need to log into the system. Pharmacy page, you can find a pharmacy. So important, again, got to be a consumer. This is the way healthcare is going. We need to be smart. We're smart with the clothes and the cars that we buy. We need to do the same thing with healthcare. So let's talk about dental real quick. We've got Delta Dental providing us HMO dental plans of bronze, silver, and gold. These are going to be very inexpensive options. HMO dental plans are great for those of you that have just need a couple of cleanings, don't want to pay a whole lot for dental. This is a great option for you. Again, far fewer choices of providers, and sometimes with these HMO dentists, they try to upsell you on everything. So my advice to you is ask for them to get a scope of work printed out for you so you can go through everything that they're going to do. If you have some work you need to get done, ask them to justify some of these charges, see what's covered insurance, what's not. Then that allows you to decide if you want to pay for it out of your pocket or if you want to challenge them on it a little bit. So those are our three options there. Then MetLife, we've got three PPO options: Gold, Platinum, Platinum Plus. PPO dental plans are fantastic because they've got tons of choice available to you. You've got lots and lots of providers available to you. The drawback, there's two of them. Number one, they cost a lot more. So you're going to pay 2 to 3 times as much for a PPO dental plan. The other thing is this calendar year maximum down here at the bottom. So a calendar year maximum is once they get done, once MetLife spends, let's say it's on the regular Platinum plan here, $2,250 in benefits for you, they are not going to pay anything else for the remainder of the calendar year. Okay. So just like with medical, we said once you hit this number, you pay nothing, but with dental, it's the opposite. They pay nothing once you hit your maximum. With the PDP or the Platinum plan here, you get $2,500, so you get more. They pay higher percentages of services as well. So again, HMO dental plans, less cost, less choice. Great for those of you that aren't as picky, that don't want to pay a lot for dental, that maybe just need a couple free cleanings. PPO dental plans are going to be fantastic for those of you that have very specific providers you'd like to go see. You want to continue those relationships and are willing to pay a little bit more for that and want the freedom. So Vision by VSP, let's talk about this for just a moment. We have two Vision plans. We have the Gold and the Platinum. Both of these plans are identical in so many ways. In fact, almost every single one. They both have the exact same network of providers you can see, the VSP Choice Network. They both have a copay of $10 for eye exams, and they get that once every 12 months. That's what these numbers down here at the bottom are. So spoiler alert, there's one difference. You can probably spot it. But this is the frequency in which you get the benefits. So $10 copay once a year. They both have a $25 copay for lenses, and you get that $25 copay once a year. The difference is with the Gold plan, you get your $180 allowance for your frames or your $150 for contact lenses once every 2 years or 24 months. The Platinum plan gives you that benefit once every 12 months. So I love the Platinum plan. Both of them are good, but I like the Platinum plan because it is a better value. If you're enrolling them by yourself as employee only, the Platinum plan will cost you about 23 tax-free dollars more per year. And for that $23 you're going to spend on the year, you're going to get $180 in allowance. Okay, so it is a really good, a good deal in that scenario. So good value. Again, both same network of doctors, same copays for eye exams and lenses. Just have to wait 2 years for frames with the Gold plan, once a year for Platinum. So let's talk about how we're going to enroll. I'm going to walk you kind of through it real quick on my other end here. Let's get out of this presentation. And you'll see here, we'll log in. Once you get to this page, you're going to get an email that's inviting you to log in. Once you do that, usually it asks for the last 4 digits of your social security number or your date of birth to verify it's you. You will change your password. Once you do so, use your email and your password, you log in. You'll see this green button on the top right that says Start Enrollment. Go ahead and click that. It's going to give you an idea what to expect. Go ahead and hit Start. Right here is where you'll see this video you're probably watching is embedded. I'm recording it right now, so it's not in there yet, but you'll find it right there. Continue. You're going to put all your information in here. Note all these asterisks that they ask for, so you need to have something in there every time. Continue. Add your dependents in there. Even if you don't plan on enrolling them, it's important to add them. You'll see why in a minute. You can just see the prices, and you can decline for them. Or you can enroll them, of course. Continue. It's going to ask me if I'm on Medicare. If I am, I would say yes, I'd add that. I'm not, so we'll continue. Most of you are not. But if you are, you'll hit add, and it's going to add for your claim, ask your claim number. This is generally your social security number with an extra letter by it. It would be on your Medicare card. So continue. I'm not adding anything. So now here we are at the medical plan. This is very important. Specify your coverage. It's going to have a little check mark and an X. The check mark means you want to enroll. The X means you wish to waive. You are not required to enroll in these benefits. You're not interested in it, if it's too expensive, if you have coverage elsewhere, you are absolutely free to decline this coverage. So you have to select something here, because watch, if I don't, I'm just seeing plans. This is our number one question. It says, okay, well, I have nothing to select. How do I select something? You have to hit the check mark. Once you do, these buttons will light up and they will be there, okay? So I'm going to enroll myself. I'm going to enroll my spouse. I'm going to waive my child. Why am I going to waive? This is required. Let's say that they're on an individual policy with Blue Shield. What's the group number? If you have this information, go ahead and put it in there. If you don't, putting in dummy information, kind of like I did, is fine as well. They even have the option all the way down here of other, other coverage, cost, choose to be on insurance, whatever it may be, okay? So once now we know what we want, we've got all the different plans here. We can compare these plans side by side here and select from there, okay? Or we can just kind of roll down and look. You'll notice on every one of these plans has these different links. So you can open up a summary of these benefits. So if you want to look deeper into what these plans cover, how they're displayed, you can do so there. There's a little how to download the Sydney app flyer there. So this is how you can do that there from your desktop or mobile device, how to print or download an ID card. And then there's the summary of benefits and coverages. This is a required document for you to open per Obamacare. So it gives you an idea of exactly what's covered and how the government, how Obamacare wants us to display this information to you. Okay, so it always goes important question, the answer to that important question, and why does this matter to you? So lots of links that are available to you in live to take you to different plans. That's a required document to open. Let's say that I'm not going to open it, just to show you how it goes. I'm going to choose this Gold Priority Select HMO plan. Remember, Priority Select means mostly Scripps doctors. If you want help finding a doctor, you can go right here to the Anthem plan right there. You'll select a state. We're in California to show you. Okay, here's another little thing to note. We don't have any member IDs or anything, so just go down here to basic search. I'm going to look for medical plans. I'm in California. My employer gets me my insurance. Select a plan. Remember, we did priority select. So we're going all the way down here to priority select HMO. For those of you with the select HMO with Sharp Doctors is right there. So I'll hit priority select. Continue. Now I can search by a county, zip code, whatever I want. I'm going to search by that. I can search by doctors' names. So as I put in names, and by put in letters and all this, a lot of times it'll start bringing up different people that I'm looking for doctors. Let's just say I'm searching for a primary care doctor, because that is required. As you see here, once you select this, at the bottom, it's going to ask us for a primary care provider information. So you want to go there? Oh, where'd I go? I'm right here. So here's a bunch of physicians. All right, let's just say this person is who I want. I can compare a few of them to each other, compare them for whatever reason. I can do different filters here, male, female, whatever I might want to look into. If this Dr. Shailam is who I want to see, this is their address, this is their phone number. I'm going to take this information here. That's the name. Put it here. Go back to here, PCP ID number. There it is right there. Copy. Paste. That's my doctor. Now my wife, she doesn't know who she wants to take, so she's just going to let me auto assign. Auto assign is a completely acceptable option here. You can go back and change this anytime. You can call Anthem Blue Cross and change your provider whenever you want. Now we're into dental. I'm going to enroll everybody here just for the sake of ease. We've got our different dental plans here. I'm going to choose a PPO plan for us. Notice with PPO plans, it doesn't require any primary care doctor, but watch when I do that, this pops up here. Again, you can auto assign all the way across. So let's just do that. We can change it later. Let's enroll everybody here. Well, we won't enroll our kid here, but it's not asking us why on Vision. It's okay. We'll take the Platinum plan. Remember, that's the one I like a little better. Here is my summary of what I enrolled in. Yep, that's what I want to do. Make sure you look at this. You can print your summary here if you wanted to print it and save it, if that's what I want. Okay, now here I did this on purpose. I did not open this summary of benefits and coverage. Remember, this was a mandatory field. So I'm going to open it now. I don't even have to really look at it, but you can. Now, once I do that, I can go back here, continue, sign forms. Now, for those of you who've used DocuSign in the past, this is what you're looking at here. Just a electronic signature in the form of typing your name. And then with your mouse, you'll do this. It'll look like you used your feet. Don't worry about it. Once you do that, it'll take you through the whole application process and let you just click everything as you go. Once you're done with that, you'll notice as you can scroll through and you can see it's the actual enrollment form. Okay. So once you do that, finish signing, and then you're all done. So that is how you will finish. Once you see the screen, you'll hit finish here at the very top. Now you go back here. Now you're at manage enrollment, and you're in a good spot there. So you will, that's when you know you're all done. You'll get an email stating that you have completed your application. Thank you. Once you do that, you can close the whole system out. So what's the next step? You're going to check your email for your ease invitation and login. Your deadline is Thursday, July 13th. If you have any questions, if you need any answers, we are here for you. Here's our information here. Reach out to us. We're happy to schedule one-on-one appointments with you to go through this and help you make the best decision for you and your family. Thank you so much for spending the time here listening to this. It's an honor to be your broker. It's a pleasure to work with you, and I look forward to speaking with any of you who have questions. Thank you.